You're watching Virginia This Morning. This segment is sponsored by Virginia Physicians for Women.
Virginia This Morning is visiting Virginia Physicians for Women, not only treating women, but really we're taking a family approach today. I'm with Dr. Stephen Pound. We have an important conversation that you talk with a lot of your patients about as that health information they're sharing with their children.
Yeah, I think it's a topic that, I as a parent am going to be approaching soon, and it's something that people are typically uncomfortable with, and how best to prepare your teens, because we want to protect them, we care about them and their safety, and it's not always a conversation that we look forward to having.
We're talking about sexually transmitted diseases and having that conversation with young people. Doctor, when is the time to start this conversation?
Well, and that really much depends on the family. If you look at studies and statistics, there are rising numbers of teens that are sexually active. And so if you look at teens age 15 to 19, the rates are actually upwards of 2/3 of teens are sexually active. And so this can't be the first conversation you have, I guess, is the main point. And so you have to be able to have an open relationship with your child. Hopefully at some point you've talked about sex or dating or commitment or however you want to broach that topic. And once you know or have sort of talked about that with them, this becomes that next layer of, okay, now how do you protect yourself once you've made that adult decision?
And as we have children heading off to college, you may have already started the conversation, but does it change when they're college age or college bound?
Yeah, it does. I mean, you're not there anymore. Your adult supervision has changed at that point, and obviously you hope that the morals and things that you've instilled in them stick with them, at least even in nuggets. But at that point, they're not in your home anymore, and so you do lose a little bit of that. And so you have to say, okay, you're in a new environment. You may be exposed to new things you haven't been exposed to before. How do you protect yourself and prepare yourself?
So some people may be comfortable having it. For those who are just starting or are uncomfortable, tips and techniques that you'd recommend?
Yeah, I mean, the best thing is inform yourself. I mean, children and teens these days are informed oftentimes. And so you need to be able to come with them with, reliable and real information. Additionally, start with open-ended questions. Have you thought about this? Have you started this? What questions do you have and what do you know? If you engage the child, engage the teen in what they already know and questions they might have already started thinking about, it tends to make them feel more comfortable.
And Doctor, if this is about educating yourself as a parent, you have to get familiar with options that are preventative for young people too.
Yeah, and hopefully at some point, when we talk about prevention, we talk about vaccines, which is one option. And when we talk about actual, prevention of STDs during acts, it becomes barrier methods primarily. And so condoms and female condoms are things to consider.
VPFW really works hard to drive this point home for parents having the conversation with young people, but really what makes them stand up and take notice and realize the real world implications?
Yeah, I think the thing that I like to remind patients of all ages is, these are not always short-term problems that can be treated with medications. Certain infections can lead to infertility later in life, and certain infections will stay with you your entire life and cause recurrences later in life and potentially need you to take daily medicines for your entire life to prevent them. So it's not always just a short-term, problem that they deal with, but it could be a lifelong chronic condition.
Part of this conversation probably also includes the age of bringing your children in, maybe for young females or young girls.
Yeah, looking at vaccinations in particular, the HPV vaccine is recommended between age 9 and 26 for both males and females. And so that oftentimes will happen with your pediatrician, and vaccination rates with the pediatricians are increasing. And normally we target age 12 to 13 for that. In terms of the first gynecology visit, we tend to recommend age 13 to 15 in terms of a sit-down discussion, talk about periods, and sort of initiate that. But truly anymore, the first pap smear isn't until age 21. And so the time in between then becomes, do they have complaints? Do they have problems? Do they need STD testing?
Dr. Stephen Pound with Virginia Physicians for Women, having that conversation with your young people about STDs. It's very important, so you're going to want to get comfortable with it. Thanks for sharing some tips and techniques with us today.
Yeah,
our pleasure.
It.
Virginia Physicians for Women has 6 convenient locations: Henrico, Innsbrook, St. Francis, St. Mary's, and Midlothian. Call 897-2100, and to reach the Colonial Heights Prince George locations, call 520-0205 or toll free 800-421 3368. You can visit online vpfw.com and learn more about VPFW's upcoming Adolescent Gynecology Seminar Series, July 29th at the Innsbruck location and July 31st at the Midlothian location. Again, you can visit vpfw.com for all the information.